Bismillahirrahmanirrahim. Hello and welcome. Today we will be discussing neurodevelopmental disorders. I am Muhammad Maratib Ali. I'm a clinical psychologist and a psychoanalyst. Uh, let's see what developmental disorders are. So, neurodevelopmental disorders, or NDDs for short, uh, are a group of conditions that affect the brain and the nervous system. Um, they affect the development of brain and the nervous system, especially during the early stages of growth and development. Um in it mostly a person's individuals a child's language is affected, so a child will not be able to speak properly like normal children. um, and their expression of emotions will be affected. They will not be able to express their emotion like sadness, happiness. They will not be able to understand other people's expression of emotions like happiness, sadness. If a mother is smiling at them, they will not be able to detect that. They will not be able to detect a mother's happiness. And they will disorders will affect their behavior, uh, their self-control, especially in ADHD. They will not be able to control their anger. They will not be able to control their motor movements. They will be constantly trying to move from one place to the other. It will affect their memory and it will affect their learning at school as well. And finally, they are usually they develop at the early childhood and are detected with delayed milestone. When we are taking the history of our clients, first thing we ask them is what how was the birth. Did the mother take alcohol before the birth of the child, and did the child the child achieve all the developmental milestones on time or not. If let's say if a child had delayed milestone, if a child started speaking later than other children, it means it has a neurodevelopmental disorder. A child has it. So, what kind of neurodevelopmental disorders are in the DSM-5? Number one is autism spectrum disorder, intellectual disability, attention deficit hyperactive disorder, specific learning disorder, and motor disorders. Now, what causes neurodevelopmental disorders from the mother side? Uh, what happens on the mother side that causes these neurodevelopmental disorders? Number one, the most biggest cause is the mother's stress. Um, normal It is normal to have stress occurs with every person. It is normal to have stress, but excessive stress, we are talking about here about excessive stress, stress that continues for a long time, stress that is much more severe than normal stress, that affects the developing areas of the brain of the child. When the child is in the womb of the mother, then the brain or the development of the brain of this child will be affected. For example, cortisol is a key hormone which regulates stress, um, and it affects the amygdala of the baby, which can result in it means that amygdala of the baby will not be able to grow normally, uh, will not be able to develop normally, which can result in autism and ADHD. Uh, and mother's illness number two is if a mother has HIV or some other disease that can affect the development of the baby and can be the cause of the neurodevelopmental disorders. Third is mother's trauma. If let's say mother has suffered a trauma and sexual abuse, war, accident, has been in an accident or has been in a natural disaster like an earthquake, or let's say hurricane, or a mother has suffered from a serious injuries, that can have negative consequences for the development of the baby when the baby is in the womb, and this can cause neurodevelopmental disorders. Uh, and finally, chemicals in the environment. If a baby is exposed to chemicals such as lead, arsenic, asbestos, cadmium, and mercury can be the cause of the neurodevelopmental disorders. Uh, and complications during birth. When the child is being born, the complications such as lack of oxygen, birth complications, and low birth weight can cause neurodevelopmental disorders. Sometimes, when a baby is born due to lack of oxygen, their color turns blue. So we detect that we can say that that causes later one of the neurodevelopmental disorders. And lastly, substance abuse. The alcohol use of the mother can cause these disorders, and smoking, especially smoking, can cause lung as tissue damage in the baby, which can then later develop into a neurodevelopmental disorders. Now, on the child side, child side, the causes of what causes neurodevelopmental disorders on the child side. Children who suffer from child sex abuse, physical and emotion abuse, they can have emotional abuse, they can have neurodevelopmental disorders. Uh, Children who get neglected emotionally and physically, child is crying but the mother doesn't help them. Uh, they get neglected physically. Mother is always busy doing her chores in the house. She's cleaning dishes, she's washing clothes, she's doing other things, but she's not interested in the children, and she's neglecting them. She's neglecting their crying, she's neglecting their happiness. This can be the cause of neurodevelopmental disorders. But the exact cause of neurodevelopmental disorders, I should mention here, is not known. We can say that combination of genetic factors and environmental factors causes these disorders. Uh, Now, divorced parents, if a parent is divorced, this can cause that mother who was treated harshly and incarcerations. And in summary, we can say that maltreatment of child is the most basic cause of neurodevelopmental disorders. Uh, Most of the children who have neurodevelopmental disorders are often maltreated children. Uh, who get neurodevelopmental disorders. And finally, genetic factors, that is, if a person has elders, brothers, mother, fathers, and their brothers and sisters, they have already have these neurodevelopmental disorders, then this can transfer into the child as well. Now, in DSM-5, we have some of the intellectual we have some of the neurodevelopmental disorders, number one of which is intellectual disability. uh, What is intellectual disabilities? How can we detect it in a child? uh, so main characteristics is intellectual deficits in intellectual functioning and adaptive behavior. Intellectual functioning will include limitations in intellectual functionings, like reasoning. They cannot learn from their experience. Something has bad happened to them, but they don't learn from it. They keep repeating the same mistakes. And they will not be able to solve their problems, and their other cognitive abilities will be affected. And second is adaptive behaviors. These behaviors include communication. Uh, they will not be able to communicate properly with other people. They will not be able to take their own self care. They will not be able to, let's say, change their clothes daily. They will not be able to bathe. And social interaction, that will be affected, and they will not be able to live independently. uh, like if a mother leaves them for let's say 12 hours in the house, they will not be able to live independently. These are adaptive behaviors. They will have the people with intellectual disabilities will have these deficits. They will not be able to be independent as a normal child would be. uh, and then finally, the onset of this should be before the age of 18, and during, especially during the developmental period when the child is growing up. That's when we will be able to detect whether a child has intellectual disability or not. Now, number two is autism spectrum disorders. This is main characteristics of this autism disorders are social communication deficits. They will not be able to understand the verbal and the normal verbal communication. Verbal meanings what we are when a person is talking to them, they will not be able to understand that. And non-verbal communication, they will not be able to understand the expression like happiness on the face of another person. They will themselves will not be able to express their happiness properly. And they will not be able to communicate verbally with other people. They will be not be able to understand gestures, facial expressions, tone of voices. And number two is repetitive behaviors. uh, they will be the children of autism spectrum disorders have very limited interests, and they are only interested in a few things or activities, and they keep repeating those activities. Repetitive interest, they will keep repeating those interests. Like for example, if a child might like original soundtrack of a movie, and they will only like that particular song, and they will keep repeating that particular song, and they will not listen to other songs. When a parent or someone tries to change that song, they will resist it severely. They'll say, no, I want to listen to this song and this song only. They can have interest in let's say a special kind of food, for example rice, and they will only want to eat that same food every single day. They don't want to change that. Similarly, if they have interest in a specific toy, they will only be interested in that toy and no other toy. Uh, and then they will have sensory sensitivities. In some cases the sensory sensitivities will be heightened, and in some cases it will be reduced. For example, if a person with autism can might not be able to feel pain, when we try to hurt the when we try to, let's say, if we try to cause pain, let's say using biting, we try to bite their hand, uh, they will not feel that pain. Children will not feel that pain. The children with autism, so in this case, they will not be able to feel that pain. This is one of the characteristics of autism spectrum disorder. Now, some children with autism spectrum disorder are high functioning and low functioning. Um, some cases they will be able to high function. For example, in case of high functioning autism, some children will have autism, they will not be able to communicate properly, they will have repetitive behaviors. But that child can remember all of the let's say when coming home with their father. The father might not know all the streets from which they can get home, but the child will know all those streets. Child will have above average intelligence in some areas, and this is high functioning autism. Now we come to ADHD. There are three types of ADHD: hyperactive, inattentive, and impulsive. Um, when a child has ADHD, attention deficit hyperactive disorder, it means he will fall into either of in one of these three categories. It will not be that ADHD, a child has ADHD but he doesn't fall in any of these categories. That does not happen. Either he will be either one of these types, or he will have multiple, more than one of these types of ADHD. Predominantly, if a child is hyperactive type, then he will be fidgeting, squirming, and he will have difficulty sitting in one place. When we observe such a child, he will be either fidgeting in his seat. He cannot sit at one place. He always wants to get out get out of his chair. He will be running here and there. He will be climbing objects. He just cannot sit still in one place. This is hyperactive type of ADHD. And impulsive type, a child will have a difficulty making decisions. He will react. He will automatically make decisions, constantly make decisions without thinking the consequences of those decisions. When he's standing in line to get something, let's say, uh, standing in line in a canteen, standing in line to wait for his turn, they will not be able to wait for their turn. When others are having a conversation, they will constantly be interrupting that conversation. Uh, they will answer questions when someone has asked them questions. They will answer those questions before even the question is finished. This is the impulsive type of ADHD. And then is the inattentive type, which is that the child will not be able to sustain attention in the tasks that require attention. They will constantly be forgetful in their daily activities, and they will be frequently losing their necessary items such as pencils, sharpeners, anything like that. And they will always try to avoid tasks that required sustained mental effort, such as tasks that required them to think. They will be avoiding such activities, and they will be easily distracted by the external stimuli, such as if a person is talking to them in a room, and there is slight distraction outside of the room. They will be easily distracted by that noise, and they will pay attention to that easily. This disorder ADHD can sometimes cannot be detected during the childhood. Sometimes it goes undetected, either because the parents did not take the child to the psychologist, or something, whatever can be the reason. But sometimes in adult cases, this gets diagnosed. And in adult, the difference between the adult and the a child ADHD is that the child can run here and there, and he will be climbing objects, but the adult, the hyperactive symptoms will be much more controlled. He will not be running here and there, but inside his head the thinking will still be going very fast. He will be squirming his he will be squirming and constantly moving his fingers here and there, etc. But the hyperactive symptoms such as climbing and running here and there will be much more controlled in the adults. Now we come to specific learning disorder. uh, This disorder is characterized by impairment in one of the three areas. Uh, in written expression, such as writing, understanding what is written; in math, solving the math problems, understanding the math problems; and reading. Uh, Dyscalculia is trouble in learning and comprehending and solving math problems. This is what we call dyscalculia. If a child has trouble in only understanding math, only math, he can, let's say, read English very well. He can understand the English sentences very well, but he cannot understand the mathematical terms that are written there. He cannot solve math problems. Then this is where he has trouble only in learning and comprehending math, and solving math problems. Then we can say he will have dyscalculia. If a child has learning difficulty in understanding and learning the writing, such as English writing, then we can, and learning and difficulty in comprehending different shapes, then we can say he has dysgraphia. And during dyslexia, he will have difficulty in comprehending the written words. He will not be able to understand what is written, uh, such as English word. He will be very slow in reading those and having trouble recognizing those words. In dysgraphia there is a difference that he will be not be able to understand the shapes very well, and he will have difficulty writing. His writing will be very distorted, whereas in dyslexia he will be able to not be able to comprehend the written words, and he will be very slow in reading and recognizing the words. Finally, we come to the motor disorders. These are unwanted movements that result from the damage to the motor system. Uh, Number one is this stereotypic motor movement disorder, in which there is involuntary, purposeless, and repetitive body rocking and hand flapping, etc. Uh, the there is a difference between this type of movement and autism spectrum disorder. In autism spectrum disorders, it will be also he will not be able to communicate properly. But in this stereotyping movement disorder, he is able to communicate properly. Uh, and now we come to the tick disorders. In tick disorders, there is a let's say like a tick for sudden, purposeless, and repetitive muscular movement, or a vocalization. Let's say a person suddenly makes some movement which is sudden, and it is purposeless, without any purpose, and it happens repeatedly. Uh, then we can say is a tick disorders, or he speaks certain words suddenly and without any purpose. Then he has tick disorders. Uh, Now, the difference between tic disorders and Tourette disorders is that in Tourette disorder, he has multiple motor disorders. In multiple motor means he might have disorder with the hand, where his hand is makes sudden purposeless movement, and he at the same time also has a leg which makes sudden purposeless movement, and only one or more vocal tics. Uh, at some point throughout their illness, and they are not simultaneous, then this is a Tourette's disorder. Uh, in persistent motor or vocal tic disorders, there is a single or numerous motor or vocal tic disorders that occur, but they do not occur at the same time. Like, let's say a person has a motor tic, but only a motor tic is occurring. Or a vocal tic is occurring constantly, but not the motor tic. They both cannot occur at the same time. Uh, this is persistent chronic motor or vocal tic disorder. In Tourette's disorder, in there is multiple motors but one vocal tic disorder at some point throughout their illness. Uh, Now, what psychological tests we can use for diagnosing the neurodevelopmental disorders? For diagnosing intellectual disabilities, we use SPM and APM, so standard progressive matrices and advanced progressive matrices. For autism spectrum disorders, we use CARS-2, Childhood Autism Rating Scale 2, or ADOS. We use one of these tests. ADOS is more modern and CARS-2 is a little bit older, but both can be used for autism spectrum disorders. There is an ADHD checklist for ADHD, and there is also corner scales which can be used for ADHD. Uh, and now we have for specific learning disorders, we can use comprehensive test of phonological processing, CTOP, and test of word reading efficiency, TOWRE. These tests we can use for specific learning disorders. Movement assessment battery and BOD2, these can be used for motor disorders. Now, treatment of neurodevelopmental disorders, it is very necessary that an early diagnosis is made, and early intervention starts. These will result in much better results and better quality of life for the child. And what we can do to treat these children is behavior therapy and medication. Behavior therapy is like an umbrella term in that there are multiple therapies. CBT that can be used. ABA therapy is mostly used in neurodevelopmental disorders. Speech therapy is used when a child is unable to speak properly, such as in Down syndrome. Their speech therapy is used. Occupational therapy is used, and medications are used for ADHD and hyperactivity. Now, is there a cure of neurodevelopmental disorders? No, there is no cure for neurodevelopmental disorders. They will remain with the child for the rest of their lives. But intervention, behavior intervention, and medication in some cases, in severe cases, medications also can help the children live a more fulfilling lives. Thank you so much, and if there are any questions, you can ask them.